Sorry, I get emotional. It's been a long journey. Excuse me. It took me 5 years to get here. This is Dr. Thomas Clark with Ogden Clinic. We're at the Logan River Clinic in Providence, Utah, and we are joining the Cardiometabolic Center Alliance. We're very excited to get this program going. It still has a long ways to go, but we are planning on providing excellent care for people with diabetes and kidney disease, diabetes and heart disease, and diabetes and heart failure. The Cardiometabolic Center Alliance is a group of clinics throughout the world that focuses on diabetes and cardiometabolic health. Most of our care in the United States is siloed. You go to the cardiologist, and the cardiologist doesn't talk to the nephrologist doesn't talk to the diabetic educator, the pharmacist in a pharmacy, different places. And the Cardiometabolic Alliance, we try to do that all in one place. We have a team-based approach. We still rely on our specialists, we still need them, but we interconnect. It's kind of like the wagon wheel, and we're the spoke in the center of the wheel, and instead of 8 silos, we have 1 silo with all the team members helping us. And as far as the providers and the team, we all get this interaction, we all get education, we're constantly getting updates. We have handouts, we have educational material, we have programs, and so it makes what I try to do so much easier. Things that I already know how to do get done much faster and much more effective, and so it helps the provider and the patient. I first heard about the certification probably about 2 years after it started, pretty early on, and I was working with an educator with a pharmaceutical company. They said, you need to find out about these people. Sorry, I get emotional. It's been a long journey. Excuse me. It took me 5 years to get here. About, I think. So they said, you are doing what they're already doing. You should join these people. This is an incredible alliance. And I had no idea it existed. And so I tried for years with the companies I was working with to try to get this done, and they said, this is too hard, this is too much, we can't do this. And that's part of why I joined Ogden Clinic, so we could make this happen. And so it's just amazing that we can do this. And to be the 20th in the world, to be in Logan, Utah, and to be the second on the entire west half of the country, and have this care that's better than anybody else gets is just amazing. Well, in the future with the Alliance, we hope to have 3 or 4 providers here. Anybody that has one of these conditions, we would love to see them. We don't have to be their primary care. We're happy to get them on goal-directed therapy and get them back to their primary care and see them once or twice a year. The Alliance has a great quotation that says, we'll do the heavy lift to get them on guideline-directed therapy, and then we'll give them back for their care and continue to be a resource for them to continue to make sure they're on that guideline therapy. But what we really hope is that this is the first in Ogden Clinic. I already have a couple other providers that are interesting to do this. There are just literally thousands of patients that have this that aren't getting care that we know they should get. And so our goal is to just keep expanding this and make it so everyone that has diabetes with heart attack, diabetes with kidney disease, or diabetes with heart failure, that they're able to get the best care available, irregardless of their insurance or circumstances.